Chronic pain sucks, and chronic pain affects literally every aspect of our life, specifically chronic lower back pain. One thing that we see a lot with our patients that we work with that have chronic lower back pain or acute low back pain is individuals have altered their basic movements in order to get around that pain. One way a lot of individuals alter their movement is by simply standing to get out of a chair or out of a seated position. Sometimes we'll see a patient do the lean over, the grab, bring the legs over, and then slowly stand up. Sometimes we'll see that between the leg, side grab, push, bring the legs back so they can get a little bit more center of gravity, and then come up. And all of that is okay, and sometimes what we have to do when we're in chronic or an acute low back pain phase. However, oftentimes once we are out of pain and we're feeling better, we continue to get up like that because we've been doing it for decades or months or weeks or whatever, and that's just what we've gotten used to doing. So one of the things we did with one of our patients who's an older patient that's wanting to get stronger, that's wanting to stay in their house and live in their house for a long period of time, is simply work on them starting to stand up without using their arms and legs. Now, we didn't say, hey, go from this to just standing up like this all the way, because that would probably be too much for them, and it was. Initially, when they did that, they struggled to stand up. So what we did is we started them with just putting their hands on their legs. So instead of grabbing a side and leaning forward and trying to get that motion going, we had them do is start here and use their hands and their arms for assistance to start really teaching and relearning how to do that basic just squat pattern. After they did this for about a week to 2 weeks, then we transitioned them to just using one arm. And then after just using the one arm for a week to 2 weeks, they started using no arms and just standing up and sitting back down. We also had them start incorporating just little small squats into their day. Instead of just sitting up, sitting down, and standing up 5 times a day, we said, hey, try doing just 20 stand up and sits down every other day, just to help build that strength of the legs and the core and help improve that overall strength and mobility. So now what they're doing is they're able to stand up without feeling imbalanced, without feeling weak. They're able to feel more mobile because of this, and overall their leg strength and their lower back strength has gotten better as well. Sometimes we want to look at low back pain and be like, it's all these things, it's all these big things that we want to change. But for many individuals, something small like just changing how you're getting out of a chair can really translate across many aspects of life. And that's why looking at those intricacies of someone's life as they're getting out of pain and transitioning to a more pain-free, resilient life is so important for us here at Optimized Chiropractic, because we don't want to just people to feel better and to heal better. We also want them to move better so they can sustain that progress that we made.